Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
All right, and welcome to another episode of the Lunch and Learn with Dr. Barry. I am your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as the CEO of Pierre Medical Consulting, helping you empower yourself for better health with the #1 podcast for patient advocacy, affirmation, and education. This week, we bring you an important discussion on the new recent guideline recommendations from the CDC regarding mask wearing. If you are, again, and this episode is going to be more pointed to the people who have gotten a chance to be vaccinated and are actually vaccinated, because these are who the new recommendation is for. So if you're not vaccinated, this, discussion doesn't necessarily pertain to you, at least at this moment, until you get vaccinated. So they said that you can actually not have to wear a mask anymore. Right. And that has gotten a lot of energy. Right. I'll say it. A lot of energy has come about since this recent decision. And we're going to talk about that today. Make sure you subscribe to the podcast. Leave us a 5-star review, especially if you're on Apple Podcasts. And make sure you tell not one friend, but tell 10 friends about the podcast episode, especially if they've gotten vaccinated as well. Today's podcast is sponsored by the Lunch and Learn Community Merchandise Store. Living out the motto, empower yourself for better health. And for the thanks of being a devoted podcast listener, I'm going to give you opportunity to save 10% off today's purchase using the coupon code EMPOWER10. Go to shop.drbarrypierre.com. Use the coupon code EMPOWER10, all one word. You will save 10% off your entire purchase. Remember, 50% of all proceeds are donated to the 5-Star Scholarship Foundation, which is a nonprofit organization giving out scholarships for high school students. Today, the question is to mask or to not mask. That is probably the #1 question that I've gotten probably within the past week. Because again, unless you're living under a rock, CDC recommendations have been updated. So I want to first start out in saying I am only talking to the people who have been vaccinated. I am only talking to the people who have been vaccinated when we start talking about this discussion today. So the CDC recommends that now, if you have been fully vaccinated, that means you've gotten both shots of the Moderna or both shots of the Pfizer or your single shot of the Johnson & Johnson, again, here in the United States, you do not have to wear a mask. And why are they doing this? First and foremost, why are they doing this? And, why is this something like you're getting to, there's two groups right now that's happening, right? That I'm seeing across social media and, a lot of the questions I'm getting. You have one faction who have gotten vaccinated and they're concerned about these CDC recommendations. And you have another group who has been vaccinated and they're ecstatic about these recommendations, right? So let's talk about both groups, and more importantly, which side, should you fall on, or more importantly, we'll even end with which side I fall on. So let's talk about the ones who are excited. I think that's let's kind of clear it up. So again, CDC says, hey, you know what? If you've been vaccinated, you can go out. And the reason why they're able to do so is because the evidence that has been shown from all of the people who've been vaccinated, at least at this point, shows that we're doing a very good job protecting people from the severe illness associated with COVID-19. Now, again, you're going to read reports, and I see a couple articles pop up every now and then. So-and-so got the vaccine, and they still picked up COVID. That's great. Understanding that the vaccine was never meant for you to never get COVID, right? Just like the flu shot doesn't mean you can't get the flu. What occurs is if you get the vaccine and you happen to get COVID-19, your symptoms and severity of those symptoms will be less. That has what's been shown in remarkable fashion. We're doing an amazing job keeping people from developing severe illnesses associated with COVID-19 if you've been vaccinated. And before, the recommendations were, if you've been vaccinated, hey, you can go around other people who are vaccinated and be okay. We're okay with you doing that. And, you don't have to wear a mask. But now they're saying hey, you know what? we are comfortable with what's happening, especially here in this country, with the amount of people who've been vaccinated, with the people, the symptoms that we're seeing after said vaccination, that if you happen to pick up the vaccine, guess what? You can kind of go out and, prosper. And I expected, we have two splitting groups that are they're not warring against each other, but they're bringing up valid concerns one way or the other. So let's talk about the group who says, you know what, I am ecstatic that now, because I've been vaccinated, I can go out and do what I want to do. I can go back to my quote unquote normal life. Those people are ecstatic because, again, those people who've suffered from, again, a year and some change right now, right, since March. They suffered through the lockdowns. They've likely suffered through some type of loss, either directly or indirectly, whether it be physical loss, like loss of family member, whether it be job loss, economic loss, or social loss, not being able to go out, not being able to travel, not being able to do that they were normally purported to do. But they couldn't because this COVID and this travel ban and everything else that happened. Now that the light, I think about it as the light at the end of the tunnel. The light is like here, it's kind of bright right now for them because now the CDC is saying like, hey, you're protected. Go out and go back to your regular normal life, which means go out and go and see, your family member that you didn't go see. Go out and do that traveling that you didn't get to do. Like, so a lot of beautiful things are happening for them. And I want to say why they're probably more ecstatic more than anything else is, and one of the things I talked about this before on the podcast, even on the channel, is that COVID-19 has played such a significant mental factor in people across the world, especially in this country, but people across the world, it's placed such a significant mental factor on them. There's a burden that they've had to deal with and face every single day. Like imagine, right? One day you wake up and you're worried that someone talking to you is giving you a deadly disease that may not make you sick, but when you go home and you talk to your grandma, may make grandma sick, right? Like imagine like that type of burden. I remember me when COVID-19 first hit, like my mom stays like 5 minutes away from my house and I couldn't see my mom. Right. Like I could not see my mom. Like I couldn't, my brothers and sisters didn't go see them. I remember sent them a message like, hey guys, like I work in the hospital, I'm a hospitalist physician. I take care of COVID patients every single day. And I'm not gonna be able to see you guys until some things are happening. Like, cause it's not safe for you. Definitely wasn't safe for me to go see these patients for COVID-19. But when you're in the profession I'm in, you kind of run to the fire. So like I had to tell family members, I had to tell friends like, hey, yeah, I can't come see you. I can't do these things with you. I had to tell, outings and things had to be canceled that I couldn't do because, COVID was here. And now we kind of fast forward and we have this opportunity with the vaccines that we have and the safety protocols that were in place and the results that we're getting after said vaccines. And now, the CDC saying, hey, you know what? I like what we see here. And the risk of picking up a severe illness, if you're vaccinated, the risk of picking up a severe illness has been so minimized by getting vaccinated that we're comfortable with you going out in frolic, going out and being in public. And for a lot of people, it's this significant weight that's being lifted off their shoulders. Now they can plan ahead. Now they're thinking about like, hey, well, you know what? I want to go for family for Thanksgiving. I want to go out of the country. I wanted to now they're starting to think things that they can do and understand that they're protected because they've allowed themselves to be protected by said vaccine. And that's one group. So now you got the second group here, right? Which is the group that says, I've been vaccinated, but I know the numbers, right? I know that less than 40% of the country has been vaccinated, fully vaccinated. I know less than 40% of the country has been fully vaccinated. And yeah, I may be protected, but if less than 40% of the whole country, that means some of my family members also aren't protected as well. And I don't want to expose myself with the chance of picking up COVID understanding that even if I pick up COVID, it may not cause any symptoms in me, or the symptoms that it causes may be mild, but it may cause symptoms to my family member who's a part of the 60% of people who hasn't had a chance to get that vaccine. I don't want to put them at risk. And because I don't want to put them at risk, hey, CDC, I don't care what you got to say. I'm not listening to you. I'm still going to wear my mask in public. I'm still going to go shop with my mask. I'm still going to socially distance as much as I can. Like, I'm still going to do those things regardless of what you just said, even though I know I'm protected. And as a physician, especially as a physician, as a public health professional myself, like I am caught in the middle per se, because I understand both points. Right. Because again, like I said, I've been hearing it. Like, people have been texting, shooting me text DMs like, oh, yes, is it time? And I jokingly said on my Instagram that like the amount of people who are suddenly gung ho for like CDC recommendations like shot up through the roof. Because before, when CDC was recommending socially distance, wear your mask, do those things there, people were like, CDC, hold up. We're not going to listen to you, government agent. But now CDC saying like, hey, if you happen to be vaccinated, you're good to go. Now people are running, right? So I jokingly said it, but like with a lot of truth behind the joke. So as a professional myself, health professional myself, as a physician myself who still takes care of patients in the hospital setting, the acutely ill patients in the hospital setting, and I can tell 100% of my family does not have the vaccine or has not been vaccinated, right? And with that whole understanding, I'm still going to be very cautious. I'm not going to be out here with my mask off, walking around talking. And even though from a safety perspective, I know I can. I love the fact that I know I can. I love the fact that I know that I am protected. I've done what I needed to do to protect myself from picking up a severe illness so I can take care of others who pick up severe illnesses. And again, it doesn't have to be COVID, because remember, before COVID, lots of diseases were causing problems. Heart attacks were still here. Strokes were still here. Infections were still here. Pneumonias are still here. Like, all these things are still bad issues that occur in the hospital setting that I'm still taking care of. So it's interesting to kind of see like the dynamic, the split, and what you're going to start seeing, what we're already starting to see is now that the CDC is saying like, hey, you know what, you're okay to be able to, not wear your mask. Like, you're going to start seeing businesses and cities and states be like, hey, CDC says we're all good. And that's why I stressed in the beginning of this video that I'm only talking to the people who are vaccinated. Because if you are not vaccinated, we are not talking to you when we say you can walk out and with no mask and you are protected. We're not talking to you. And we want to make sure we stress that you are not a part of that conversation if you are not fully vaccinated. Now, again, you may be the type who says, I was never going to get that vaccine anyway. Cool. Right? It's your decision. It's your choice. Understand that the risks are still there. Understand that a person like me who is vaccinated, who may decide to walk around with no mask, and I may have picked up COVID because, again, I take care of patients in a hospital setting. But because I've got the vaccine, I'm protected. But if I give that to you, you're not protected, right? Like, that's a risk you have to deal with. That's a risk that you're going to have to take. And that's a risk that most people who weren't wearing masks or weren't vaccinated were already taking anyway. They were already kind of weighing that pros and cons. Like, hey, I don't want to wear a mask. I don't want to vaccinate. For whatever reason, I don't want to vaccinate. For whatever reason, I don't want to wear a mask. And I'll take whatever risk comes with that. So just understand that you're going to have a bevy of people that, especially if you're in my first group who are like vaccinated and like are jumping for joy because now you can do what you want to do. Understand that you're going to have a lot of people who never got vaccinated who are also doing that same thing. And it's so funny because I saw somewhere where like the CDC kind of wants us to kind of do almost like an honor system. Like if you know you weren't vaccinated, please still wear your mask and do those things there. Guys, have you lived in this country, United States of America? No. The honor system is not happening, right? So if you're me, you just have to, again, and that's how I've kind of been operating. You just have to assume everyone has COVID. You assume everyone has COVID until proven otherwise. And if you carry yourself as if everyone has COVID until proven otherwise, hopefully you'll be fine, right? And if you're in that age bracket, I call the super invincible age bracket, where you don't get really sick and you're a champion, and you don't think you don't need to do these things like eat healthy, exercise, and all those things that you typically have to do. If you're in that age group and you're like, I was gonna get the vaccine anyway, I'm not getting it, I'm cool, all right. But understand that the risk of you picking it up and you giving it to a family member is still there, right? Like you'd be surprised the amount of patients I've taken care of in the hospital setting that their family members are the primary person to give them the disease, right? It's like they stayed at home, they stayed to themselves, they wore a mask, they did everything they needed to do, but their family members did it. And because their family members did it, their family members put them at risk. And unfortunately, I've had patients who passed away, right, based off that aspect. And imagine that conversation. Like, imagine having a conversation with someone saying, like, yeah, I know you weren't socially distancing. You gave grandma COVID-19, and now grandma is going to pass away. And unfortunately, because grandma has COVID-19, you can't even come see her. Right? Like, imagine having to wear that on your heart for the rest of your life, right? And again, unfortunately, and I wish I was being hyperbolous, that is a true story that has been happening across the country for a year and some change now, right? Where a family member who didn't adhere to the practices that was recommended gave it to another family member who was much more susceptible, and then that happened. So again, I think this news is big. Trust me, it is. I think from a mental standpoint, from a physical standpoint, from an economic standpoint, from a social standpoint, this news is huge. What you do with the news is going to be up to you. Again, defer to your provider and whoever's taking care of you to kind of figure out which decision you want to go. But understand that plenty of risks are there. Understand that, the numbers do show it, right? Because I have some people who are like, well, I don't trust the CDC all of a sudden give me these recommendations. Someone must be in their back pocket. No, that's one thing about the CDC, especially that, now that we have a new regime in office, is that you don't have to worry about that type of influence. Like, the recommendations they're giving is based off the numbers. Strictly and remember, we talk about numbers a lot here. When we talked about the Johnson & Johnson having those cases, I said, hey, based on the numbers, 6 out of 7 million, that's not enough to say stop giving this vaccine. Especially if you didn't get the vaccine, that number is usually like 2 to 5 per million, right? So it was just a lower number. So just like this, like, they're watching the numbers, and trust me, they watch like a hawk. Like, I got my vaccine in December. Yeah, December. No, the last vaccine was in January. So let's say I was done with being vaccinated in January. I still get text messages till this day saying, hey, just checking up on you. How are you feeling? Any symptoms? Have you been dying? Like, I still get those numbers. So trust me, we are tracking the numbers. We are tracking the data because we want to protect the general public, right? That's our goal, to protect the public. Get everyone as healthy as we can, get everyone back to a level of normalcy as fast as we can. Everyone wants to do that. It's not, no one does not want to do that. So it's just a matter of how do we take care of the population while doing so. So again, you're going to have some people who are uncomfortable, right, with the new recommendations. You're going to have some people who are jumping for joy for new recommendations. So really the question is, what side do you follow? Thank you for coming to the end of the episode. It is yours truly, Dr. Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there because your support is so valuable for what we're doing here on the Lunch Learn and everything with Pierre Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222, and you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out, because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thanks, guys. You have a blessed day, and I'm going to see you guys next week.